On the session itself, so for example, this is your first session, you run your diagnostic, you've chosen your treatment, and you start treating the person. The main thing here I will focus on is to observe their reactions. Not necessarily you need to talk to them, and especially not necessarily you need to talk to them all the time. And there are some schools of Colourpuncture which advocate constant engagement with the patient and asking them questions, and this is a kind of conversational hypnosis, and this totally works. I've done it, and I had really, really beautiful result. However, this might not be for every patient. This might not be for every therapist. You need to be specially trained to do this. And this might not be for any situation, because sometimes, for example, you put on the light and the person is really, really, really relaxed, and you can feel it. You can see those muscles, contracting in a particular way. You can feel the eyes close, and you can see the little movements beneath the eyelids. You can tell that they're really, really deeply relaxed. So in this situation, I wouldn't ask them questions, because basically body knows better. Body already receiving therapy, and you just hold in space. You hold in the space, you're doing your Colourpuncture, and you observe. What is important when you observe in the reactions? Basically, surely they can say something. They can comment, oh, this is pleasant, this is unpleasant, this is neutral. By the way, don't forget, if they mention that something is unpleasant, you stop treating this point and you move to the next point. Or in some situation, you can choose color for complementary color. For example, you're treating them with orange and this is too much, you switch to blue, and or vice versa. Then, of course, you observe their muscle reactions, you observe their facial expression, and sometimes you can tell a lot just by observing the person. Sometimes they give you reactions in certain areas which are significant for acupuncture or Colourpuncture or other therapy which works on a principle of reflex zone. This way you can really choose your further treatment strategy, because basically they will tell you where the problem is. They will say something, or my lower back suddenly hurts, or I feel tension in my temples, or something like that. And based on that, you can lead them further on the next session. This is something you need to write down, and this is something that you need to take into account on your next meeting.